Bismillahirrahmanirrahim. This is a small lecture about combined oral contraceptive pills for MBBS final year students, and I am Professor Gulfreen HOD of Obs and Gynae. So just a brief overview of the combined oral contraceptive pills. These pills contain two hormones, that is estrogen and progesterone, and they are very commonly available in Pakistan for a very long time. There are two types of packs which are available. One are those which have 28 pills, and out of these 28 pills, 21 have hormones or active medicine, and 7 are placebo, which either contains iron or lactic sugar. The other type of pack which is available has 21 tablets, and all 21 tablets have the hormones estrogen and progesterone. So these are present in a combination of estrogen and progesterone, and the progesterone usually available is levonorgestrel. There are other type of progesterone which might also be present, like desogestrel, etc. But the estrogen is usually ethyl estradiol, and this is present in a very low dose. As you can see from the slide, that this is between 35 microgram to 20 microgram, which is an extremely low dose, and this is kept low so as to avoid the hazards which estrogen might cause. The mechanism of action is threefold. Firstly, it prevents ovulation. It prevents the release of the ovum from the ovaries. And then it also causes changes in the endometrium and making it less compatible to implantation of the fertilized ovum. And thirdly, what it does is that it thickens the cervical mucus so that the sperm penetration is also obstructed. So acting in these three ways, how does it suppress we have to see how does it suppress ovulation or cause these changes in the endometrium and the cervical mucus. We have to revise our HPO axis, or the hypothalamus pituitary ovarian axis, and we know that the hypothalamus produces the gonadotrophin releasing hormones, and then the pituitary produces the stimulating hormones, the FSH and LH, which stimulate the ovaries to produce estrogen and progesterone and cause development of the follicle as well as ovulation. So now this entire axis is disturbed by the oral contraceptive pills, which are synthetic estrogen and progesterones, and these, when taken, give a negative feedback to the pituitary and the hypothalamus and the pituitary, saying that there is estrogen and progesterone in the body, so the release of FSH and LH is inhibited, and so is the development of the follicle and the ovulation. So on the other hand, because these hormones are absent now, and as there is no development of the follicle and the ovulation, so the endometrium doesn't develop properly for implantation, and the cervical mucosa also remains thick. So considering that, we see that what are the benefits of oral contraceptive pills, and why should we use COCs? So these are highly effective. So according to statistics, only out of 100 women, 0.1 to 5 women might get pregnant with its use for the first year. Which is a very good success rate, and it is immediately effective. It is started within the first 5 days of menstrual cycle. Pelvic examination is not required. It does not interfere with the intercourse, has very few side effects. It is convenient to use, and the patient can stop it anytime they want to, and as soon as they stop it, the fertility returns to normal. There are certain non-contraceptive benefits also with this, and the non-contraceptive benefits are that this decreases the menstrual blood flow. It also reduces the menstrual cramps. Naturally, if there's less blood flow, it improves anemia, and it also protects from the woman from the ovarian and the endometrial cancer, and decreases the incidence of benign breast diseases and ovarian cysts, and also prevents ectopic pregnancy, which is a problem with the intrauterine devices. So when should you start? When should the woman be told that when can she start it? She can start it at any time when she's not pregnant, but the best time to start is between the first and the fifth day of the menstrual cycle. It can also be taken after the delivery, postpartumly, about 6 months if the woman is using lactational amenorrhea method, and after three weeks if she's not breastfeeding. It can also be used after abortion, immediately after abortion, or within first 7 days. So the best time to start out of delivery or the childbirth is on the first day of menses, but it can be started to the fifth or the seventh day as well. There are minor side effects which might occur with it, such as nausea, vomiting, headache, dizziness, breast tenderness and enlargement, which is known as mestalgia, slight weight gain, chloasma or acne, or there could be menstrual abnormalities, such as breakthrough bleeding, a bit of irregularity in bleeding, loss of libido, and whitish vaginal discharge, which is not infective, known as commonly called leukorrhea. But then there are certain major risks which are also associated with this, though they are very low, but have to be kept in mind that one of those is venous thromboembolism. It does give causes DVT or the deep vein thrombosis. However, the incidence caused by COCs is much less than that caused by the childbirth and during the purpurium. So there's a very little risk of breast cancer in the predisposed women, or ovarian cancer and cervical cancer with long-term use of COCs. So how can we manage these side effects? You just have to reassure the patient that there is the nausea, dizziness, and the mild breast tenderness, headaches, etc. Spotting will go away after 2 to 3 cycles. So really, she doesn't need any treatment for this. But if the symptoms are too much to affect the quality of life of the woman, then you can advise some treatment. The instructions which we have to explain to the patient while when she starts the pills is that she has to take one pill every day, preferably at the same time of the day. And the first pill should be started on the first day of the periods, but if not possible, it can be started within the first 7 days of the menstrual cycle. In a pack of 28 tablets, she should take all 28 tablets. First 21st will contain medicine and the last 7 will not have any medicine. And then she can wait for about 7 days or till the start of next period. Once the next period starts, she can start taking the medicine again. But if, however, she vomits, then she has to take two medicines or take up another pill or use a backup. However, if she misses the pills, sometimes the women do forget to take a pill. If she forgets to take one or two pill, then then you should tell her that you should take the forgotten pill as soon as you remember, plus keep taking the routine pills as usual. If she forgets to take 3 or more pills in the first or the second week, then she has to take a hormonal pill as soon as she remembers, use a backup method, that is condoms or IUCD if she prefers, and do not have sex for the next 7 days. And if she can also consider emergency contraception if it prolongs. Now, if she has missed 3 or more pills during the third week, then again she has to take the hormonal pills as soon as she remembers. She has to finish all her pills in the pack and throw away the 7 non-hormonal pills in the 28-day pack and start a new pack from the next day. And she should use the backup method for 7 days or consider emergency contraception if she had sex in the last 5 days. So if missed or any non-hormonal pills, then you discard the missed non-hormonal pills and keep taking COCs once every day and start a new pack. However, there are certain warning signs that we have to keep in mind. As I said, that there are certain risks associated with the taking of COCs. So we have to tell that she must immediately report to a doctor if she experiences any chest pain or shortness of breath, severe headaches or blurring of vision, severe pain in the legs, which indicates DVT, deep vein thrombosis, or any absence of bleeding or spotting while taking 7 inactive pains. It could be a sign of pregnancy. So these are the things that she must keep in mind and report immediately if there's something like this happens. So this was a very brief review about the combined oral contraceptive pills. So if you have any questions, I'll be glad to answer them. And if not, thank you so much. Happy studying.